When this opened up, we were kind of excited because it's a lot more convenient. The traffic's better, the parking's better, and this facility's pretty nice.
Army veteran Scott Simpson of Rockville says going to the doctor used to take the better part of a day when he went to the VA Medical Center in D.C. for services.
To go to the main hospitals, just because parking is always a nightmare, they're always very crowded.
But now he and other veterans are cutting their commute and wait time by going to the new Montgomery County Community-Based Outpatient Clinic, or CBOC, on Gaither Drive in Gaithersburg. It's the first of its kind in Montgomery County and accessible by Metro or the Ride-On bus.
I definitely think this is a step in the right direction. I think the hardest thing as someone who has had a lot of issues since getting out of the military is that the system by itself is just overwhelming.
We provide primary care, we provide social work, we provide psychology and psychiatrists.
Tanya Curry, the chief nurse of ambulatory care for the VA Medical Center in D.C., says the clinic also offers nutritional counseling, pharmacy consultations, and specialty care. Since opening last September,
We're roughly seeing a total of 100 patients a month, which is really good for this area. We only have 2 providers for primary care, so we're slowly building our panels.
Patients span all ages and turn to the clinic for a myriad of issues, both mental and physical.
The main ones are hypertension and diabetes, some with congestive heart failure and some with pulmonary disease.
No matter what the reason,
we don't turn our veterans away. If they come in as a walk-in, we let them in, and we are open until 4 o'clock to let them in and be seen by our providers.
roughly half of the services offered involve mental or behavioral health. The folks here at the VA say they are committed to lifting the stigma around depression and PTSD.
I'm also a veteran myself, and I have seen the difference between the kind of care we have been providing before and what we're doing now.
Nurse manager Alfredo Bandong says staff are committed to doing everything they can to break down barriers and make things easier for veterans with medical issues. In fact, the clinic now offers what's called telemental health.
These are when the veterans sits at home, looking at the camera or on the computer, and they are being attended or being consulted by a psychiatrist from this station, also from the physician out in the medical center.
Wow, so they don't even have to come out here.
They don't have to come here.
Big changes that have made a world of difference for veterans like Simpson.
For those people who don't have an advocate or don't have family, I would say if you can at least pick up the phone to a place like this. I mean, my experience so far is that they just took ownership of the problem and helped out. So I would hate for people to think, I'm not even going to try, it's too difficult, especially if they're really suffering.
He says veterans need not suffer in silence. I'm Nancy Yamada for State Circle.